Hey guys, today's video is all about the National Commission for Allied and Healthcare Professional Bill 2020. Keep watching. Hey guys, so welcome back to my channel Yashki Experience. First of all, happy Holi to all of you, and I would also like to thank my YouTube followers who are following my videos, who are watching my videos continuously. Thanks a lot. One of my follower actually suggested me, and he even asked me why I'm not making a new video on the bill recently passed. So I would like to tell you that it takes a lot of research behind the scene, to get the full information. So I'm going to tell you what is the bill all about and how it all started. So guys, it all started in December 2018 when a new bill was passed in Rajya Sabha. It was named as Allied and Healthcare Bill 2018, and then it was passed to the Standing Committee in 2019. But then they took it off, and because of some reasons, and now they have introduced a new bill in 2020 on 15 September. It was named as the National Commission for Allied and Healthcare Professional Bill 2020. It's a long name actually, I know. Minister respected Dr. Harshvardhan from the Ministry of Health and Family Welfare, he introduced this bill, and what are the things covered in this bill I'm going to share in this video. So guys, let us discuss about the governing body who are going to be in this bill. So they are. It has been decided that there will be a chairperson who will be having more 25 years or more than 25 years of experience in allied and healthcare profession, and then below him there will be a chairperson, and then there will be 5 members of at least level of the joint secretary, which will be representing various departments or ministries of central government, and then there will be one representative who will be Directorate General of Health Services. Then there will be 3 deputy directors or medical superintendents who will be selected from AIIMS or AII PMR, and then there will be 12 part-time members representing state councils, and all these will be the governing body in this bill. Now I'm going to tell you some of the key features of this bill. So allied health professionals, it will be those who will be an associate technician or technologist who will be trained to support the diagnosis or treatment of any illness, disease, injury or impairment, who will obtain a diploma or degree under this bill. During the diploma or degree, they should have completed at least 2000 hours over a period of 2 to 4 years. Now the second is the healthcare professionals. So it will include a scientist, therapist or any other professional who studies, advises, research, supervises or provides preventive, curative, rehabilitative, therapeutic or promotional health services. It will be obtained through a degree under this bill. It has to be of the duration of at least 3600 hours over a period of 3 to 6 years. Now, who are included in allied and healthcare professions? So the recognized categories are mentioned in the schedule of the bill. Now they have included life science professionals, trauma and burn care professionals, surgical and anesthesia related technology professionals, physiotherapists, nutrition science professionals. They have actually given 10 categories in which they will be covering 56 different courses who will be counted and who will be included in this bill. So guys, now we are going to discuss the functions of this bill. So the functions of this bill will include framing policies and standards for regulating education and practice. It will help in creating and maintaining an online central register of all registered professionals. Along with it, providing basic standards of education, courses, curriculum, staff qualification, examination, training, maximum fee payable for various categories, and providing for a uniform entrance and exit examination, among others. So these are going to be the main functions of this bill after the committee is made. Now we'll discuss about the professional council which will be formed after this bill is passed. So the first will be a professional council. It will have the commission, means the commission will constitute a professional council for every recognized category of allied and healthcare professionals. Like if there is a physiotherapist, then they will make a committee for this. If there are those who have done the lab technician courses, either they have done a diploma or a bachelor's or a master in lab technician, so they will make a committee for this. And likewise they will make a committee for each and every healthcare and allied professional, and then they will make a state council. So within 6 months from the passage of this bill, the state government will constitute a state allied and healthcare council, which will include different aspects and different categories, different courses which will be covered in this bill. And then they have to classify every course, every different aspects of the allied and healthcare professionals in this bill. So guys, after the state and professional council is formed, there will be certain functions which will be given to them. With the main functions will be to enforce professional conduct and code of ethics to be observed by allied healthcare professionals, to see whether those other courses and other people are not are following the rules or not, to maintain respective state and all the other representative colleges and different aspects of the field, like physiotherapists, and as I have already told you about the lab technicians and all. Inspect allied and healthcare institutions. Those institutions which will be under this bill, they will conduct a normal survey and they will check whether these institutions are following the rules which are given under the bill or not. And at last, ensure uniform entry and exit examination. There are several universities or different colleges who perform examination separately or differently. So after this bill is passed, they will have to follow the same thing. They have to follow the same pattern and same syllabus as well. So guys, after this bill is passed, every institution and every university will come under this bill, and they have to follow the norms. Just in case if someone wants to open a new institution, then they have to take the prior permission from the state council. Just in case if there is already an institution which is registered and they want to introduce a new course, they have to take the permission from state council. If they want to increase their admission capacity, or they want to introduce a new batch in the same course, or if they want to increase the fees, they have to take the permission from the state council. In some cases, if any of the university do not follow the rules under this bill, or if any of the student who passes from the university will not be recognized as a qualified professional under this bill. So guys, at last, offenses and penalties. If government introduces a new law or any bill, then it is the responsibility of every citizen of India to follow those. And if we do not follow it, government imposes some sort of punishment on us. So according to this bill, no person is allowed as a qualified allied and healthcare practitioner other than those who are enrolled in state register or national register. If any person who contravenes this provision is found, then he have to pay around 50,000 rupees to the government as a punishment. Hey guys, so this was the bill all about. I tried to give you the basic information of the bill and I tried my best to give you. So according to me, there will be several advantages to the students and healthcare professionals who will be enrolled in this bill. The first and foremost is to get the validation all around the world. As you know that in UK, HCPC is the main council and everyone have to follow the same norms. If there will be a state council who will be under the national council, then we will all have to follow the same rules and same guidelines, and it will be represented as a national council as well to other countries. If any of the student or any person goes outside India to do a job, apart from this, there will be no fact institutions who are actually giving admissions on a lower cost or on a lower fees. Then there will be equal opportunities, equal fees, same syllabus will be followed after the bill is passed, because every institution, every university have to follow the same norms. And then the ethics, about the ethics. So there will be an ethical practice. The training will be given to each and every healthcare professional nicely, and there will be a standard maintained of all the professionals. Then after this bill is passed, there will be several aspects and which will get job opportunities, will get the salary as well, because after the bill is passed, they will also decide the salary, how much every healthcare professional should get. After this, there are few states there where there is no state council even. So those after this bill is passed, every institution, every university will be recognized under this bill, and every student, either he is from south side of or he is from north side, or any part of the India, he will be recognized under this bill, and he will be representing means after this bill is passed, he will be recognized all over the India according to the bill and under the same norms. Hey guys, so at last I just wanted to tell you that if you take out a PDF of this bill online, then it is more than 30-40 pages. You can go through this bill, you can study it by yourself. It takes a lot of efforts to go behind the scene and get the information, and to know what was the history and how the things goes. I also want to congratulate you all guys that we are going to get a state means like national level recognized council, in which under which we all will be recognized and we will be registered. Then we'll also have the state council as well. I also want to congratulate all those healthcare professionals, all those politicians, all those leaders who have been working continuously day and night behind these all things, and now they have come up with something great, and this is really a very good news for all of us. And I want to congratulate everyone on this from my side and from Yashka Experience. So guys, it was a quick review of the bill. Keep watching my channel. Namaste.